Most men miss one early urinary change, then prostate trouble starts quietly. Hi, I'm Dr. Ross. In this video, you learn how early prostate changes show up and what action protects your health. If you care about health, follow this channel. 2 points guide this discussion. 1 daily habit error many men repeat. 1 serious outcome when action starts late. The prostate sits below the bladder. It controls urine flow through the urethra. With age, prostate tissue stays active across decades. Hormone changes, low-grade inflammation, and reduced blood flow build pressure inside the gland over time. At age 60, many men already show prostate enlargement. At age 70, most men show clear growth linked to urinary symptoms. This condition is called benign prostatic hyperplasia. It affects urine flow strength and daily comfort. Night urination appears first. Sleep breaks once during the night. Later, sleep breaks multiple times. Urine stream becomes weaker. Morning bathroom routine takes longer. Urination start feels delayed. Bathroom visits increase during the day. Movement starts to depend on toilet access. Early changes look small. Many men ignore them. Pause here. This matters. Ignoring early urinary change allows pressure inside bladder and prostate area to build over time. 1 common mistake stands out: holding urine during work, travel, or long daily activity. This habit increases internal pressure step by step inside the urinary system. 1 serious outcome follows. Bladder strain rises. Prostate irritation increases. Symptoms appear earlier and progress faster. The bladder stores urine under controlled pressure. The prostate sits directly under the bladder outlet. When urine stays inside too long, bladder walls stretch beyond normal range. Repeated stretching weakens bladder muscle strength. Weak bladder muscle reduces control during urination. Pressure transfers downward toward the prostate. Prostate tissue reacts with irritation and mild swelling over time. Hesitation appears before urine flow starts. Urine stream becomes weak. Flow stops mid-urination. Straining increases. Dribbling appears after urination ends. Night urination increases across weeks and months. Full bladder feeling remains after bathroom visits. These signs show progression inside the urinary system. Many men call this aging. That belief delays action. This is where many men get it wrong. Early urinary changes reflect stress inside bladder and prostate system, not simple aging alone. Delay allows inflammation to grow inside prostate tissue. Bladder control weakens further. Pressure inside the system increases over time. Sleep quality drops. Energy level reduces during the day. Daily comfort declines. Life starts adjusting around bathroom access without awareness. Do you wake at night more than once to pass urine? Some men reduce water during the day, then drink large amounts at night. This pattern increases night bladder load and worsens symptoms. Prostate enlargement does not start suddenly. Growth builds from repeated pressure, inflammation, and reduced circulation over many years. Small daily habits shape long-term outcome. Pause here. Urinary changes signal early internal pressure already active in the system. Without correction, frequency increases. Flow weakens further. Sleep becomes broken. Daily stress increases. Early signs do not stay stable when ignored. Progression follows a pattern. Night urination increases step by step. 1 time, then 2 times, then multiple times per night. Sleep cycles break repeatedly. Deep sleep reduces. Morning fatigue increases. Daytime urgency increases. Small urine volume triggers strong urge signals. Work focus reduces. Travel becomes stressful. Social comfort reduces due to constant bathroom planning. Urine flow changes become more noticeable. Flow starts slower. Flow becomes weak or interrupted. Some men feel need to return to toilet shortly after finishing urination. This signals incomplete bladder emptying. At this stage, bladder coordination reduces efficiency. Bladder sends stronger signals even with small urine volume. This leads to frequent bathroom visits during day and night. Men adjust behavior without noticing change progression. Seats near exits become preferred. Travel routes change. Sleep interruption becomes routine. This adaptation happens slowly. Now, focus on what drives this inside the body. Inflammation inside prostate tissue increases due to repeated pressure and low circulation. Hormonal shifts with age support gradual tissue growth. Bladder muscle fatigue develops from repeated stretching cycles. These three processes interact over time. Pressure increases bladder sensitivity. Sensitivity increases urgency signals. Urgency increases bathroom frequency. Cycle continues without intervention. Early urinary symptoms respond better to simple lifestyle correction compared to late-stage conditions. Late-stage conditions involve stronger bladder weakness and larger prostate enlargement. Timing changes outcome. Many men wait for severe symptoms before seeking help. Many believe this is normal aging. That belief delays action. Medical findings show urinary system changes follow a measurable pattern, not sudden aging shift. Another mistake appears here. Reducing water intake strongly does not solve urinary frequency. Low fluid intake increases urine concentration. Concentrated urine irritates bladder lining. Irritation increases urgency. Core issue involves bladder control pattern and prostate pressure balance. Now, early warning signs that should not be ignored. Night urination more than once per night. Weak urine stream that needs effort to start. Dribbling after finishing. Sudden urgency with little warning. Long delay before urine flow starts. These signs show stress inside urinary system. Many men ignore these signs for months or years. Progression continues during this time. Bladder muscle strength reduces further. Storage control becomes unstable. Small urine volume triggers strong urgency. Night sleep becomes fragmented. Daytime energy drops. Focus declines. Mood stability reduces. Daily routine shifts around bathroom access. Work output reduces. Travel comfort reduces. Social activity reduces. These changes affect quality of life more than most men expect. Final key point. Longer untreated duration increases difficulty of reversal. Early stage responds to simple correction. Late stage needs stronger medical treatment. Timing matters. Many men arrive in clinic after years of symptoms. They often say they thought it was normal aging. But urinary system changes follow consistent biological patterns. Body responds to repeated habits over time. Bladder responds to training and urination control habits. Prostate responds to reduced inflammation and better circulation. Small daily changes influence long-term outcome. Early action improves symptom control and slows progression. Ignoring early signs removes control over outcome. Next section moves into clinical evaluation, treatment steps, daily correction system, and prevention strategy for long-term urinary health. When a man walks into clinic with urinary symptoms, first step involves detailed history. Not assumptions, not guesses. Pattern matters. Doctors ask clear questions. How many times night urination happens? How urine stream feels? How long symptoms have lasted? Whether changes came slowly or suddenly. Whether urgency appears with small urine amounts. Each answer builds a pattern profile. Next step is urine testing. This checks infection, blood presence, and inflammation inside urinary tract. Some men with similar symptoms show different underlying causes at this stage. Next step is prostate evaluation. Physical examination checks size and firmness. Imaging adds more detail on structure and growth pattern. Some cases include urine flow measurement. This test shows how strong urine exits and how efficiently bladder empties. These steps help classify severity: early stage, moderate stage, advanced stage. Now understanding shifts to treatment direction. Early stage cases rely mainly on lifestyle correction. Body response at this stage remains strong. Symptoms often improve with structured daily changes. Moderate stage cases may need medication. These medicines relax smooth muscle in prostate area. Flow improves. Pressure during urination reduces. Advanced stage cases require closer supervision. Some require procedures when blockage becomes significant and bladder function weakens. In clinical experience, timing changes outcome more than treatment type alone. Men who act early respond faster. Men who delay progress into more complex management. Now focus moves to control system in daily life. Start with urination response behavior. When urge appears, response should be immediate. Delay increases bladder pressure. Repeated delay trains bladder into unstable behavior pattern. Next is fluid timing control. Water intake supports urinary system function. Pattern matters more than amount. Higher intake during morning and afternoon supports healthy flow. Lower intake before sleep reduces night disruption. Large fluid intake late evening increases night urination frequency. Next is movement pattern. Pelvic circulation depends on daily activity. Walking improves blood flow around bladder and prostate region. Long sitting periods reduce circulation and increase pressure buildup. Short movement breaks restore flow balance inside pelvic area. Next is weight balance. Abdominal fat increases internal pressure on bladder system. This pressure worsens urgency and reduces control. Even moderate reduction in body weight improves urinary stability. Next is dietary control. Inflammatory foods increase irritation inside urinary system. Processed meals and high-fat intake late at night increase pressure during sleep hours. Balanced meals support long-term system stability. Now attention shifts to system prevention. Prevention depends on repetition, not one-time action. Daily habits either support bladder function or stress it further. No neutral condition exists over long term. Now deeper mechanism explanation. Bladder control depends on muscle coordination. When overstretched repeatedly, coordination weakens. Prostate response depends on inflammation and circulation balance. When circulation reduces, tissue becomes more reactive. These two systems interact continuously. Bladder sends urgency signals. Prostate adds resistance to flow. Combined effect increases symptoms. Men with early symptoms show improvement when three behaviors change together: reduced urine holding, regular movement, controlled fluid timing. These three actions reduce system pressure faster than isolated changes. Now, progression awareness. Early stage symptoms remain flexible. Body responds to correction quickly. Moderate stage shows slower response. Improvement still possible, but requires consistency. Advanced stage shows structural limitation. Symptoms improve partially, but require medical management support. This is why early recognition changes outcome direction. Now, lifestyle factors that influence urinary stability. Stress level increases bladder sensitivity. High stress increases urgency perception, even with small urine volume. Relaxed nervous system reduces false urgency signals. Sleep quality also influences urinary control. Poor sleep increases night urination frequency and reduces bladder stability. Now, clinical observation pattern. Men who improve fastest share consistent habits. They stop delaying urination. They move regularly. They adjust fluid timing. Men who struggle most continue holding urine for long periods and remain inactive for long hours. Now, prevention system explained simply. Morning routine supports activation. Hydration, movement, early urination response. Daytime routine maintains balance. Regular breaks, controlled fluid intake, movement intervals. Evening routine reduces load, lower fluid intake, lighter meals, bladder emptying before sleep. Night routine focuses on response, no holding urine during sleep period. Now progression warning. If early signals remain ignored, bladder muscle weakness increases. Storage control becomes unstable. Small urine volume triggers strong urgency signals. Night sleep breaks repeatedly. Energy drops. Focus reduces. Daily routine becomes structured around bathroom availability. Many men seek help only after lifestyle disruption becomes serious. Sleep loss becomes main trigger for consultation. At that point, system already shows long-term adaptation changes. Now, important understanding. Urinary system does not fail suddenly. It adapts slowly under repeated pressure patterns. Correction works best when applied early in adaptation phase. Now, improvement principle. Bladder function improves through retraining. Regular urination timing restores control patterns over time. Prostate inflammation reduces with improved circulation and reduced pressure cycles. System recovery depends on repetition, not intensity. Now, mistake pattern in many men. They attempt short-term changes, expect quick reversal, then stop when improvement feels slow. Urinary system requires consistency across weeks and months. Now, outcome difference. Early correction reduces symptom progression significantly. Late correction focuses on stabilizing existing damage. Now, system control summary. Daily behavior influences urinary system more than isolated medical intervention alone in early stages. Now, next transition. Next section completes full system. It shows final daily protocol, warning levels that require immediate medical attention, long-term protection system, and final guidance for maintaining urinary health stability. At this stage, everything becomes practical. No theory, no guessing, only actions that protect urinary function and reduce symptom progression. Start with warning levels first. Some urinary changes require immediate medical attention. First warning level is urine retention. When urine becomes difficult to pass, even with strong urge, this suggests significant blockage inside urinary pathway. Second warning level is blood in urine. Even small traces require evaluation because this may indicate internal irritation or other underlying conditions. When sleep breaks multiple times every night consistently, bladder control system is under high stress. Fourth warning level is pain during urination. This changes condition complexity and requires proper clinical assessment. Fifth warning level is sudden loss of control. When urine leaks before reaching toilet, bladder coordination is weakening. These signs do not represent normal aging patterns. These signals show system overload. Now move into full protection system. Protection starts with morning behavior. Morning hydration supports kidney and bladder activation. Water intake after waking helps flush overnight urine concentration and resets bladder function for the day. Morning movement matters. Light walking activates pelvic circulation and improves blood flow around urinary organs. Early urination response sets control tone for the entire day. Delaying first urination increases pressure pattern for hours. Now, daytime system. During daytime hours, bladder control depends on rhythm. Regular bathroom breaks reduce pressure buildup. Waiting too long increases bladder stress and trains unstable urgency patterns. Hydration balance must stay consistent. Long gaps without water, followed by sudden intake, create unstable bladder signals. Movement breaks support circulation. Sitting for long periods compresses pelvic region and reduces blood flow to prostate area. Now, evening system. Evening routine affects night stability more than most men realize. Fluid intake should reduce gradually as night approaches. Large intake close to sleep increases bladder load during rest hours. Heavy meals late at night increase abdominal pressure during sleep period. This pressure affects bladder expansion space. Emptying bladder before sleep reduces night interruption risk. Now, sleep system. Sleep quality connects directly with urinary stability. Interrupted sleep increases bladder sensitivity. Sensitive bladder increases urgency response even with small urine volume. Stable sleep reduces urinary signal overactivity and improves overall control. Now, body structure system. Body weight directly influences urinary system pressure. Abdominal fat increases constant internal pressure on bladder region. This reduces storage comfort and increases urgency frequency. Weight reduction improves bladder space function and reduces mechanical pressure on prostate area. Now, inflammation control system. Inflammation builds slowly across years. Food pattern and lifestyle determine intensity level. Processed foods increase inflammatory load. High-fat meals late at night increase overnight urinary stress. Balanced diet supports lower inflammation levels and improves long-term urinary stability. Now, movement system. Movement is not optional in this system. Better circulation reduces congestion around prostate tissue and improves bladder response stability. Long sitting periods reduce oxygen flow to pelvic organs and increase pressure buildup. Now, mental stress system. Stress influences urinary control directly. High stress increases urgency perception. Bladder signals become exaggerated even when volume is low. Calm mental state reduces urgency sensitivity and improves control timing. Now, progression understanding. Urinary system follows predictable stages. Early stage shows mild symptoms. Body still responds quickly to correction. Moderate stage shows consistent symptoms. Improvement requires structured daily system. Advanced stage shows structural changes. Medical support becomes necessary alongside lifestyle control. Now, important correction mindset. Improvement is not instant. Bladder muscle adaptation requires repetition. Prostate response depends on long-term circulation improvement. Short effort does not create long-term change. Consistency creates change. Now, real clinic pattern. Men who improve fastest follow 3 behaviors. They respond immediately to urination urge. They walk daily without long gaps. They control evening fluid intake. These 3 actions alone reduce symptom severity in early stages significantly. Men who struggle continue delaying urination. They remain inactive for long hours. They ignore night fluid timing. Now, system summary. Urinary health depends on pressure balance inside bladder and prostate region. Pressure increases when urine is held too long. Pressure decreases when response is immediate and circulation is active. Now, control principle. You either reduce system pressure daily or increase it daily. No neutral position exists long term. Now, final prevention strategy. Prevention is built from repetition. Morning activation, daytime balance, evening reduction, night response. This 4-phase system stabilizes urinary function when followed consistently. Now, outcome difference. Early action reduces progression speed and improves comfort levels. Late action focuses on managing established structural changes. Now, final message. Urinary symptoms are not sudden failure events. They are gradual system signals building over time. Ignoring early signals leads to stronger symptoms later. Responding early maintains control over progression. Now, final recap. Watch for early changes, like night urination, weak stream, urgency, and incomplete emptying. Act early using walking, controlled hydration timing, consistent urination response, weight management, and reduced inflammation lifestyle habits. Now, closing statement. Most men wait too long. That is the mistake. Small urinary changes are warning signals, not normal aging. This video is for educational purposes only and does not replace consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe to this channel and stay informed.